Today we have the pelvic cavity in the male. We have the first structure is the rectum. This is the rectum. Okay, this is a bisagittal cross section of the body. So this is the one side and the other side is removed. So this is the viscera open. This is the bladder and this is the rectum. This is the internal surface of the rectum. The rectum is the continuation of the sigmoid colon. It becomes the rectum. Then the rectum opens into the anal canal, and then through the anal canal the waste materials can be expelled. At this region, at the region where the rectum meets the anal canal, there is an angle known as the anorectal angle, which is formed by the sling of the puborectalis part of the levator ani muscle at this region. So this is the rectum. The rectum in the superior third or first third, it is covered laterally and anteriorly by the peritoneum. In the middle third, only anteriorly, and in the lower third, it is devoid of peritoneum. It is in contact with the seminal vesicles and with the prostate gland and with the vasa differentia and rectovesical fascia. Is in contact with these structures and separated from the urinary bladder. Also, in the space between the urinary bladder and the superior two-thirds of the rectum, we have in this region a pouch, which is known as the rectovesical pouch, which is a fold of the peritoneum that encloses this area, which is the most inferior part of the body. In the other sample, it was more clearly observable. So it is here, okay? Then we have the urinary bladder. This structure is the urinary bladder. It is the organ that contains the urine and has a capacity of about 500 milliliter in the adult. Its shape and relation is changing according to the amount of urine it contains. In the empty bladder, this is the empty bladder, it is pyramidal in shape. That means it has an apex and a base. It has a superior surface and two inferolateral surfaces and a neck. However, as it fills with urine, it becomes ovoid and not pyramidal anymore. And its superior surface projects into the abdomen, into the hypogastrium region, but not the neck and not the posterior surface. So this is the empty bladder, which is pyramidal in shape. First of all, we have the apex. The apex projects anteriorly and is found behind the upper margin of the symphysis pubis. This is the symphysis pubis, the upper margin here. So the apex should be in this position, in the living object. Okay, so this is the apex. The apex is attached to the umbilicus by the median umbilical fold. This is the median umbilical fold, or the remnants of the urachus. Okay, so this is the apex. Posteriorly, we have the base. This is the base, or also known as the posterior surface. It projects posteriorly, and on the superolateral angles, at these angles, we have the ureters. This should be the ureters that open in these angles, and inferiorly, the inferior angle gives rise to the urethra. This is the membranous part of the urethra, which passes downward. Okay, so this is about the angles of the posterior surface. Okay, the posterior surface or the base is covered in its upper part by peritoneum. So it is covered until here in this region, where it reaches the upper part of the seminal vesicle. It is covered by peritoneum, and from here it leads to the rectum, passing to the rectum, forming the rectovesical pouch. Okay, then we have the superior surface. This is the superior surface of the bladder. The superior surface, as you can see, is covered by peritoneum. This is the peritoneum. Okay, it's completely covered with peritoneum, and as the bladder fills with urine, it is arising into the hypogastrium region, which is the lower abdominal cavity. Okay, so this is the superior surface. Then we have the two inferolateral surfaces. This is one inferolateral surface, and this is the other inferolateral surface. It is continuous anteriorly with the retropubic pad of fat, which is found here. Posteriorly and superiorly with the obturator internus, posteriorly and inferiorly with the levator ani muscles. Okay, so this is about the inferolateral surfaces. Then we have the neck. The neck projects inferiorly and is contact with the prostate gland. This is the prostate gland enclosing the neck of the bladder. It is held in position by the puboprostatic ligament in the male and pubovesical ligament in the female, which projects anteriorly, should project from here. Okay, he said it could be this one, project from here. The muscular layer of the neck of the bladder with the muscle layer of the prostate become continuous. So there is no clear demarcation between the prostate and the neck of the bladder. So we may say that the prostate encloses the neck of the bladder. Okay, so this is about the bladder. Then internally, we have the mucous membrane. The mucous membrane of most of the, or the majority of the urinary bladder is thrown into folds. As we can see, these are folds. Except for a small area in which the mucous membrane is lining the internal surface of the base. we said this is the apex and this is the base. So internally below here we have the trigone. It's the area known as the trigone, which is smooth. It has no folds even when the bladder is empty. So it should be in this area. See, this is one of the ureteric openings. This is a bisagittal section. So the other ureteric opening is here. So this area here, like this, form a triangle known as the trigone, which is smooth. Okay, on the superolateral surface of one trigone, on the trigone, we have ureteric openings. This is one of the ureteric openings. On the other side, we have another ureteric opening here. And internally, in the inferiorly, it gives the rise to the internal urethral orifice. This is the internal urethral orifice, which leads into the prostatic urethra. Okay, so this is about the trigone. Here, into the prostatic urethra, in the upper part, we have an elevation. This is the uvula. Uvula vesicae, which is a muscular elevation that is formed mainly by the median lobe of the prostatic gland. We said the prostatic gland, this is the prostatic gland. The median lobe of it pushes onto the internal mucosal wall and the muscular wall, forming this uvula vesicae, okay, which is at the opening of the urethra. Between the two ureteric openings of the trigone, one from this side and the other from the other side, there is a muscular ridge known as the interureteric ridge. Okay, here this is the prostatic gland and the neck of the bladder. Inside it we have the prostatic urethra. Okay, this is the prostatic urethra, which leads into the membranous part of the urethra, which arises from here. This is internally. This is the prostatic urethra. Okay, like that. It's about 3 centimeters long. The prostatic urethra is the widest and most dilated portion of the urethra. Inside we have internally a crest in between. This crest is known as the urethral crest. Okay? The urethral crest, on the two lateral sides, we have sinuses known as the prostatic sinuses. The prostatic sinuses receive the secretions from the prostate gland. Okay, and on the upper surface, is not easily seen here because tiny structures. On the upper surface of this urethral crest, we have the utricle, prostatic utricle, and lateral to the prostatic utricles, the ejaculatory ducts open. This is one of the ejaculatory ducts coming obliquely because this is a cross section. So it opens here. In this area we have the utricles, this is the crest, and on the lateral sides we have the prostatic sinuses. Okay, then we have another structure in the male, we have the prostate. This is the prostatic gland, which is about 3 centimeters long. The prostatic gland is found, it has an apex and a base. The base is in contact with the neck of the bladder, and the apex projects downward, the apex, and is contact with the urogenital diaphragm. Okay, so this is the prostatic gland. Okay, this one is the prostatic gland, and the prostatic gland surrounds the prostatic urethra and produces a secretion which contains citric acid and acid phosphatase, which produce alkalinity in the seminal fluid that resists the acidity in the female reproductive tracts. Okay, then we have the seminal vesicles and the vasa differentia. These structures, which are like coil tubes, are the seminal vesicles found on the posterior surface of the urinary bladder, separating the two vasa differentia, which are found medial to it. So these are the vasa differentia found medial to the seminal vesicles. The seminal vesicles produce a secretion that nourishes the spermatozoa as they pass into the urethra, into the penile urethra. These are the vasa differentia, which are ducts that convey the spermatozoa, the mature spermatozoa, from the epididymis into the ejaculatory duct. The vasa differentia start at the tail of the epididymis, and then as they reach the posterior surface of the bladder, they become dilated, forming the ampulla. This dilation is known as the ampulla of the vasa differentia. And also the seminal vesicles, as they come inferiorly to meet the vasa differentia, they become narrower. Both of them join together to form the ejaculatory ducts. We said this one of them, this one was one of the ejaculatory ducts. Okay, like that. This is the remnant of the seminal vesicle, and this is the vas difference. Both of them join to form the ejaculatory duct. This one is the ejaculatory duct, one of them. Okay, so this is about the vasa differentia. Also about the urinary bladder, we have the ureters. This is a ureter. Okay, the ureters join the kidneys to the urinary bladder, They enter the pelvis at the ischial spine level. They pass downward on the lateral surface of the pelvis. Then, as they reach the ischial spine, they turn internally to pierce the posterior surface of the bladder. They pass obliquely through the bladder wall. This oblique passage of the ureters form as a valve that prevents the backflow of the urine from the urinary bladder into the ureters and the kidney, which could cause renal failure if happened. Okay, that's it. I don't know.